Good afternoon, everyone. My name is Jerome Bailey, and I am with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar. The ESRD NCC Webinar events are held in partnership with the Centers for Medicare and Medicaid Services. We are hosting these 30-minute events weekly. They feature patients and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted to the NCC COVID-19 Webinar webpage. We usually post the recordings within 48 hours. So let's take a look at the agenda for today's call. We have two speakers. Patrick G. is a kidney transplant recipient who experienced COVID-19, and Susan Cooper is a licensed clinical social worker. Our call topic is surviving and coping with the aftermath of COVID-19. We will have time towards the end of the call to answer your questions. You can submit questions at any point in the call by using the chat feature through WebEx or the Q&A icon on the lower right of your screen. When we get to the question and answer section of this presentation, we will share the questions we have received with our speakers. So, what's this call about? You'll hear tips on coping in the COVID-19 environment. We'll provide real-world experiences for others to put to use. This call allows us to engage with you weekly on various topics. So, we'll begin with Patrick. Patrick is a transplant recipient from West Virginia. He received his new kidney in April of 2017. Since his ESRD diagnosis, he has become a patient healthcare activist, fighting for a better healthcare system and better quality of life for those suffering from chronic illness. He's a father of 5, a fierce patient advocate who visits Capitol Hill regularly to speak to lawmakers about policies that concern those living with kidney disease. In fact, he was headed to D.C. when his transplant center called him to tell him not to go to D.C., and I believe that was the beginning of his COVID-19 journey. So Patrick, what were the first symptoms you noticed, or what led you to believe, or your transplant center to believe, you may have had COVID-19?
My first initial symptoms were a low-grade fever, runny nose, headache, severe headache, and extreme coughing. So,
I understand that your wife also had COVID at the same time. What was it like being a caregiver to your wife, because she was sicker than you?
Yeah, it was kind of like a competition. Whoever woke up that day and felt the best was the caregiver for each other. But as her symptoms got worse, it was just by the grace of God that I was able to give her the proper care before she went into the hospital and after she went into the hospital.
What did you do to take care of your mental health care?
I did a lot of praying. I did a lot of reading. I was reading like a book a week. I had to learn the difference between isolation and solitude. It felt, isolation is more punitive and restrictive, and solitude allowed me to be more optimistic and reflective. So after I learned that difference, I stayed in a state of solitude, just hoping and praying that we would eventually overcome the positive test that we received.
So, what were your greatest fears during this experience, if any?
Some of my greatest fears were misinformation. It had gotten to one point where I literally had to turn the TV off and just stick to reading my emails, updates from the NCC, CMS, CDC, because it was just a ball of confusion. Initially, during the time that I was positive, nobody really knew how to address people with kidney transplants and COVID. And that was to include my treatment team at my transplant center. And their method of treatment was based off of what was being treated for transplant patients in Seattle, Washington, and New York City at the time.
So who were your support systems during this time? I know you and your wife usually are very connected and working with each other. I know she was your care partner during your transplant, during the transplant process for you. So who were your support systems?
My pastors, I have spiritual mentors that were there. I had friends and peers from the kidney community that checked on me and gave me encouragement. And then, my wife and I, we had to learn how to encourage each other in the midst of sickness, which can really pose a challenge, but I guess, Jerome, I could say it strengthened our marriage, because when you literally see somebody that's sicker than you encouraging you more, it just gives you the tenacity not to quit on yourself or the people that's supporting you.
How has this experience impacted your overall health? And, and how are you doing now? How are you maintaining your health?
Recovery for me was rather up and down. Even though I had tested negative, the medication that I was prescribed during that time had adverse effects. So initially, when my wife was recovering, I was becoming more severe. So it caused me deep sadness, especially not being able, my wife stayed in the hospital for a week, so only being able to FaceTime her, it was really challenging, and her situation, the way she was treated while she was in the hospital, it just caused severe sadness and, bouts of hopelessness at times, but not a state that I had stayed in. So right now, I'm doing a lot better. Still dealing with a not so much a severe cough, but a cough due to the medication that I'm on now, and that's one of the side effects. But overall, I'm a whole lot better. Just kind of concerned about the resurgence of this new wave of people being affected.
Yeah. And so now that communities are starting to opening up, what advice would you have for kidney patients?
I would tell kidney patients to take every precautionary measure, because people's definition of freedom does not include protection of people living with chronic diseases or chronic kidney disease. The challenges that we're faced with, people not wanting to wear a face mask or even, keep proper hygiene, really puts us at risk of being infected or possibly being reinfected. So I would just tell all kidney patients just to take extreme precautions, just be careful, just be mindful of who's in your environment, and you just really can't depend on folks to take the initiative to keep you safe. You also have to play a part in take your own safety as well.
All right. Well, Patrick, thank you very much. I want you to hold on. We're going to get back to you in our question and answer period. But now we are going to hear from Susan Cooper. Susan is a licensed clinical social worker. She has been working in dialysis for 10 years in several clinics in New Mexico and Florida. Susan is a member of the ESRD Network 15 Medical Review Board. She lives in Santa Fe, New Mexico, and works in a transitional care unit called Home Dialysis of Santa Fe. Susan, thank you for being with us.
Much, Patrick, for sharing your story. That was so powerful. And I'm so grateful to be on this call today to talk a little bit about coping with loss during such unsettling times. I feel it's important for us to find meaning and hope in how life has changed us. These changes in our lives are so fast-moving. I feel that many of us are wanting our lives to return to some sort of normalcy, and yet for those with chronic conditions like kidney disease, everyone still has to be so extra careful, like Patrick was sharing with us. Next slide, please. We don't only grieve for what's missing, but also for the ways in which these losses affect our sense of self. We have to allow ourselves to freely express our emotions. It's okay to feel anger. It's okay to feel sad. It's okay to cry. Our emotions are communicating something, and we have to try to listen and find ways to express ourselves, like calling a friend, talking to your social worker, and like Patrick said, he had his pastor and other spiritual guidance, people in his life that were helping him. Praying, find someone that you can listen to. If you need to drive up to the woods and scream, do it. It's been said that the only cure for grief is to grieve. And I just wanted to share a little quote that I love by Rumi that says, "The wound is the place where the light enters you." Next slide, please. So what can we do? There are many ways to cope with loss and the grief that comes with it. There are a lot of different ways. Having a daily routine is very helpful. Caring for self, identifying thoughts and feelings and how it influences behavior, and finding connectedness during isolation. In times of uncertainty, it can help to find some certainty in life. Having a routine or a self-care plan helps us be more intentional about the way we choose to live. One way to look at this time is to ask ourselves what we would like to accomplish, learn, or experience during this time. We will recover. This is temporary, and many of us are asking ourselves what we want our lives to look like once this is over. Next slide. Every person experiences grief and loss on their own time. The grieving process it's the natural healing process that happens when we experience a loss. And the grieving process really depends on the significance of the loss, the level of attachment, a person's beliefs and values, a person's culture, and the kind of support they have in their life. Don't be afraid to ask for help. You don't need to suffer alone. Daily routine does help ease depression and anxiety. There are a lot of people that are reporting really good and news about how having a daily routine or a self-care plan has helped them. One way to create a self-plan, it doesn't mean that you have to write down exactly when you wake up, when you shower, when you go to bed. For some, this may help, but you can also write down what you would like to accomplish during the day, sort of a checklist of some sort. Think of what you want to accomplish, what you know brings peace, comfort, and joy into your life, and write it down. And make time for the pleasures and things in your life, like doing crosswords, praying, listening to music, taking a walk, calling a friend, exercising. It's like scheduling an appointment, and goodness knows all of our patients have plenty of appointments, but these appointments are important too. Once you have written down what you do in a day and you have added some certain tasks that you want to accomplish that you feel are going to help you, you can take a little time each day, whether it be the morning or the afternoon or the evening, to just reflect on what is working and what wasn't working, and modify your list or your checklist. If you're experiencing a significant loss, you need to give yourself the time and the space that you need to feel your pain. This may mean that you need to sleep more than normal. You may need outside resources to help you with meals or go to the grocery store, or you may need outside counseling from your pastor, your priest, your social worker. There's also online grief support groups and outside therapists for more intense psychotherapy. And I can't emphasize this enough. Your social worker is here for you, and your team is there for you as well. So, and you may have family or friends that you may want to reach out to. Next slide. Another way to bring certainty into your life is choosing to care for yourself. Caring for oneself is something that we can control. It's often easy to fall into despair during such troubling times. We need to identify the ways that we can best care for ourselves. You may need, again, some outside resources or help from your family or a caregiver, and your social worker can help you with this too. So some of these, just a few examples of some self-care that our patients can do is sleeping. Sleeping is huge. So try to make sleeping a priority. I know that people on dialysis often have trouble sleeping anyway, but there are many handouts out there that talk about ways to naturally improve your sleep, and I included a link here from the Sleep Foundation that hopefully will help. Eating healthy foods is important. Ask your dietitian to help you design a healthy kidney-friendly meal plan, and set weekly goals for yourself to manage your phosphorus, your potassium, and your protein. You may need outside resources such as Meals on Wheels or Instacart. Instacart has been really helpful for couple of the patients here at our clinic, and also for some friends and family that I know that have chronic illness. And managing your fluids and your sodium during times of stress will lessen your anxiety and keep you feeling well. And exercise. If you haven't been exercising, talk to your doctor, but just any kind of movement, even if you're laying in your bed and you're raising your legs, any kind of movement is really good for your body. And as Patrick also shared, that he did limit the amount of time that he spent watching news, and I think that's so important. We're so bombarded right now with so many different things on the news, and the headlines can be quite frightening. And I just think that we just have to limit, the amount of time that we're watching the news. And also you can utilize the network's handout on reliable sources of information on COVID-19. Also, one thing that really helps is deep breathing. It truly does help when you're feeling stressed. And one easy breathing exercise is to just try closing your eyes and breathing in through your nose for the count of 3, and hold it for the count of 3, and then exhale for a count of 3, and don't knock it if you haven't tried it. It really is a simple practice that's been shown to really alleviate stress. Next slide, please. Identifying thoughts and feelings, identifying thoughts and finding more helpful ways of thinking is important during COVID-19. These, listen to your thoughts. We often express some of these thoughts out loud, like, I can't deal with this anymore. I feel like a piece of me is missing. I feel like there's a hole in my heart. I don't know what to do or feel anymore. These thoughts that we often say out loud, these are called automatic thoughts, and we need to challenge some of these automatic thoughts. For example, do I really not know what to do or feel anymore? Probably not. You could probably take one step at a time. Identifying our thoughts, feelings, and how they make us feel, it does take time. And your social worker can also help you with that. They've been trained to do cognitive behavioral therapy, and they can help you, give you some exercises to strengthen those skills. The key goal is to identify what you're thinking when you feel sad or fear or anger or any strong emotion. Our thoughts and our feelings and our emotions and our behaviors are all connected. And if you change one of those things, if you change the way that you're thinking, it's going to influence the way that you feel and behave. And if you change the way that you're behaving, it's going to change the way that you're thinking and feeling. And there are many, like I said, there's a lot of different ways of strengthening that. If you have experienced a significant loss, this exercise might be a little too overwhelming. Grief comes in waves, and it can be very unbearable at times. Eating, sleeping, and caring for yourself can become a chore for those that have intense grief. You may need help finding resources at home or in your community to help you through this. For people that have anxiety disorders, COVID-19 may be extremely stressing, and they may need outside counseling and possibly even medication to help them cope. So if anybody's having any problems with anxiety, and you're not able to sleep, and you want to talk to your doctor and your social worker about that. Next slide. So many of us are social beings that need to be around people, and yet we need to be careful and practice social distancing. Social isolating can be very lonely for many people. Maybe there is someone that you haven't spoken with for a while that you might try to call again. Calling an old friend may be a great connection. Every person should have a special someone that they can call when they need to. Maybe there's a patient even that you feel close to at your clinic. You can ask them if they would like to talk by phone. Some people are quite happy during this time too, and I'll talk a little bit about that. But I wanted to just kind of go over some of the ways that we can connect right now. Social media is something that a lot of people are using, apps like Zoom. And if you're not familiar with how to use some of these different tools, you can always, a lot of the patients here at our clinic, they have grandchildren and children that are computer savvy, and they've been very helpful in showing them how to use it. Talking on the phone to friends and family is always helpful, and also there's online support groups and even online exercise classes. Finding solace through nature, going for walks or sitting outside really does help the ease of feeling alone. Taking more interest in your pets or possibly even adopting a new one. Church services on TV. Some churches are even doing their services by phone. And telehealth counseling, there's online book clubs, there's films, YouTube videos, and of course, as Patrick shared with us, prayer and meditation also can ease those feelings of aloneness and help you feel that you're connected. And so there's a lot of different ways, but these are some of the things that I wanted to share with you. And I hope that some of this has been helpful. I wish everyone all the very best right now. And remember, this is temporary, and we need to remind ourselves that. And also, it's important to know that you don't have to do this on your own. Your dialysis team is there for you. Your social worker can help you. You can talk to your family and your friends. And there are outside resources that are available too that I know your social worker will help you. And I just wanted to say thank you so much for the opportunity to talk today. And thank you so much to Jerome. And thank you so much, Patrick, for sharing your story.
Susan, thank you very much. We're so glad that you could be with us this afternoon. We do have time for a few questions that we've actually received quite a bit of questions in the chat. But if you have a question for one of our speakers, please submit it using the chat feature through WebEx or the Q&A on the lower right of your screen. We'll try to get to as many questions as possible. Our first question is for Patrick, and someone asked, how did the two of you and your wife, get COVID-19? Was it from work, family, or friends? Were you able to identify the source?
Both my wife and I were coming back in town. I was coming in from D.C. She was coming in from Tennessee. But that next day, which was March the 14th, my pastor called me and told me that that one of our church members had tested positive, and I had interaction with her during a Bible study that Tuesday. So because of that, I went and got tested. Now, it took me approximately 4 tries to get tested because at that time I didn't have symptoms. Even though I told them that I came in contact with somebody that was infected, it wasn't enough. I was almost on my deathbed before I finally got a chance to get tested. One of the interesting things about the test was that I tested negative for influenza A and B, and I had to wait 10 days for my test results. So by the time I found out that I was positive, it was March the 30th.
So we have a question for Susan. What are some of the struggles you're seeing with your patients, and how are you and your team helping them to cope?
Well, I think that we've been very fortunate, and I hope that we continue to be as fortunate as we are. But I think that people really want to, return to their lives. They want whatever, they want to be able to go into restaurants and shopping, and they want to be able to get out of their house and do the things that they once did. And so I think that's been really, really challenging for them to be at home and not just freely be able to do whatever they want to do. And our team has been amazing. I mean, our nurses have, we've been providing a lot of education to our patients about infection control, how to stay really safe with COVID. We've also presented a lot of the different flyers, sent them via email. We've been the nurses and our management team have been furiously setting up telehealth. And so we've been just really trying to accommodate our patients so that they can stay home. They are coming in for labs, but, we've limited the amount of contact that they have with a lot of the auxiliary staff, which would include me. So a lot of the time that I spent with the patient is by phone. So, yeah.
Okay. Another question for Patrick. You mentioned your concerns about a resurgence. What, if anything, are you and your wife doing to be extra protective?
Everywhere we go, we have created a survival kit. So we have at least 10 different masks at our disposal at any given time wherever we travel. We keep several bottles of hand sanitizers, Lysol wipes, Lysol spray, and stuff like that. We really limit the areas that we go to, especially if we know that there's going to be a large crowd and the potential of people not wearing a mask or not really having any regards for any medical challenges that we may have. So we just limit our movement.
Okay. And that kind of answers another question we received that was for Patrick. As states are beginning to move into their post-COVID phases, what steps are you taking to develop your new normal?
Yeah, the same thing. Actually, to even add more to that, when I got my kidney transplant, I was in a new normal. But I've noticed that everybody doesn't have the same normal. So what is normal for you? Please keep doing it.
All right. I'm afraid that we are out of time right now, but I want to thank Patrick and Susan for taking the time to be with us this afternoon. Your thoughts on today's calls are very appreciated. We'd now like to tell you, you're welcome. We'd now like to tell you about the Kidney Hub. It's a fairly new resource created by the ESRD NCC with input from our patient subject matter experts. It's a mobile-friendly web application. It has resources for patients and professionals. It has links to COVID-19 information, transplant information, home dialysis, infection prevention, and more. And then we recently have a new video on high KDPI and increased risk kidneys. So go to or on your web browser, type in thekidneyhub.org, and on the right corner menu side, you'll find a way of how to save it to your web browser on your phone or tablet. So our next webinar event patient webinar event is next Tuesday, but tomorrow we have a special professional webinar event titled Dialyzing Patients in Skilled Nursing Homes During COVID-19. We have guest speakers from Dialyze Direct, Concerto Renal Services, and Signature Healthcare. The presenters will identify methods mitigating the spread of COVID-19 in the nursing home setting. We'll also discuss the benefits of in-house dialysis related to minimizing exposure to COVID-19. And it's a special time for tomorrow's event. It starts at 3 p.m. Eastern Time. And thank you all again for being with us this afternoon. For additional COVID-19 resources, visit the CASER website at casercoalition.com. You can also review additional COVID tools at the kidneycovidinfocenter.com. Thank you, everyone, and have a good evening.